Welcome, everyone, and thank you for joining us for SAMHSA's Peer Support Workers for the Military Affiliated Population Resources and Examples webinar. I am seeing that many of you are starting to join. We will allow a minute or so before folks start to join. We had a lot of enthusiastic, appreciative registration for this event, so we will continue to take a few minutes to allow everyone to come into the room, find your seats, settle down, enjoy a cup of your beverage of choice. To orient you, and I will be repeating this and sharing in the chat, you should be able to see the chat where you will be receiving communications from me as the webinar host. We ask that you communicate to the panelists using the question and answer pod. So you will not be able to utilize the chat to communicate to the panelists. We have well over 1,200 registered attendees for this webinar. And so we would need to make sure that the way that you're going to communicate any questions that you might have will be through the Q&A pod. So you should be able to see on Zoom that you have the Q&A. So the chat on the bottom where you will be receiving messages from me, but you will also have the Q&A. The Q&A, you will be able to send questions to us, and I will be able to either answer them or share them with you. One question already coming in. I'm seeing the numbers slow down, so thank you. One of the questions is, will there be a certificate of attendance for this webinar? Absolutely, there will. At the end of the session, when the webinar closes, there will be a survey, and the survey will also have a certificate of attendance link, which you will be able to input your name into that certificate and then be able to indicate that you attended the webinar. So we appreciate that question. So as I'm seeing the numbers of attendees slowing down a little bit, we'll go ahead and get started. My name is Dwayne France. I am the co-director of SAMHSA's Service Members, Veterans, and their Military Families Technical Assistance Center. We partner with our friends at SAMHSA to be able to provide this support. One brief announcement. You will see that one of the presenters we were planning to highlight, Zach Kinney from stackup.org, will not be joining us today. Mr. Kinney sends his regrets, but he and his team are currently addressing an emergency that precludes his participation today. I'm confident that we all recognize that emergencies often happen in our line of work and are critical to address immediately. I've expressed our appreciation and support to Mr. Kinney. If you want to find out more about the Stack Up Overwatch program, I will be providing a link to their program, as well as a peer-reviewed article that was published in 2021 related to their peer support efforts. So to begin with, I would like to introduce your moderator. Your moderator for today's webinar will be Stacy Owens, the Military and Veterans Affairs Liaison for SAMHSA. She is honored to have the opportunity to facilitate collaborative efforts to improve the mental health of our nation's service members, veterans, and their families. She has 20 years of experience in various healthcare and social service settings. Prior to joining SAMHSA, she served the SMVF population for 13 years as a clinical social worker at the Department of Veterans Affairs and the Department of Defense. Stacy, welcome.
Thanks so much, Dwayne. Hello, everyone, and thank you for joining us for today's webinar on peer support for the military-affiliated community. Peer support services are increasingly getting their deserved recognition as an integral component of the behavioral health continuum of care. At the same time, those who've served in uniform or worked with those in uniform know that peers are just an irreplaceable component of the fabric of military life. You might hear the term battle buddies, comrades, brothers and sisters in uniform. No matter what the term that's being used, there's that reference to an appreciation for others with that same lived experience. So we're extremely glad to honor the synergy of peer support and the military connected population. And we're glad that you joined us today to learn more about these needs and how to address them. Next slide. Before we begin, please note that the content expressed in this presentation does not necessarily reflect the views, opinions, or policies of SAMHSA. Next slide. This webinar is being sponsored by SAMHSA's Service Members, Veterans, and Their Families Technical Assistance Center, which partners with communities, states, and territories to increase behavioral health support for the SMVF community. SAMHSA is the agency within the Department of Health and Human Services that leads efforts to ensure that mental health and substance use treatment needs of all Americans are understood, including the needs of the SMVF community. Next slide. The SMVF TA Center is a national resource that supports interagency collaboration between military and civilian stakeholders, provides a centralized mechanism for connections and sharing of lessons learned, increases awareness of and access to resources that support the behavioral health needs of SMVF, supports coordinated responses, and encourages implementation of best practices. Next slide. The SMVF TA Center offers training and technical support through various activities, including academies, crisis intercept mapping workshops, webinars like this one, learning communities, and TA call series, as well as subject matter consultation and dissemination of resources. Next slide. So let's talk about the learning objectives that we have for you today. They include demonstrating the important role trusted peers can play in connecting SMVF to resources, providing an overview of SAMHSA's resources for peer support workers, and also demonstrating effective examples of organizations that have implemented peer support worker training model. Next slide. So we are excited to feature two dynamic speakers. First up, we will have Elizabeth Sweet, who's my SAMHSA colleague and works within SAMHSA's Office of Recovery. Liz has worked at SAMHSA for over 25 years, largely focused on the issues of families raising children with mental health challenges. Her background is that she has an undergraduate degree from the University of North Dakota, as well as a master's degree from North Dakota State University. Her job within the Office of Recovery is public health advisor, where she continues to focus on family involvement across the lifespan and all of behavioral health. We're really excited to feature these resources because SAMHSA has recently stood up this Office of Recovery, and that's where our peer support resources live within SAMHSA. Liz is also the Gold Star mother of Sergeant Thomas J. Sweet II of the Big Red One, first of the 5th Field Artillery Unit of Fort Riley, Kansas. After Liz, we are going to hear from Major Mark Graham, retired Major General, and also Executive Director at Vets for Warriors, which is housed at Rutgers University Behavioral Healthcare National Center. In this role, Major Graham supports the Vets for Warriors peer support program, 10 state peer support helplines, and the state suicide crisis line, and 3 COVID-19 specific lines. So we're going to hear a lot about the peer support that happens within those programs. Major Graham retired from the U.S. Army after almost 35 years of service. He and his spouse Carol are tireless champions of military and civilian efforts to promote mental health and suicide prevention awareness, and also to eliminate stigma surrounding mental health care. They do this work honoring the memory of their sons, Second Lieutenant Jeff Graham, who was killed in action by an IED in Iraq, as well as their son Kevin, who was a senior Army ROTC cadet who died by suicide in June 2003 while studying to be an Army doctor. So we are very honored to have these two advocates whose life work has really been influenced by honoring the legacy of their children. So we're honored to have these Gold Star parents here presenting for us about their work. So next slide, please. I will turn the floor over to my SAMHSA colleague, Elizabeth Sweet. Liz?
Hi, Stacy. Thank you very, very much. It is a pleasure to be here this afternoon with all of you, and I bring greetings from the Office of Recovery and our director, Paolo Del Vecchio. And I would just like to say that in addition to being a Gold Star mom, I'm also the wife of a Vietnam veteran and a sibling to many military members. So this program today and the services that we are going to be talking about are very close to my heart. Next slide, please. I also have the same disclaimer that Stacy had, that these are all of the information that I'm going to be providing are pieces of information that are in the public domain. So anything that you see that I present is available on our Office of Recovery website. Next slide, please. So I want to start with the recovery definition from the Office of Recovery. It is a process of change through which individuals improve their health and wellness, live a self-directed life, and strive to reach their full potential. One of the things that I want to share with you is that part of that definition is that is important in that it came to our office not only from stakeholders, but also through the eyes and experience of all of the staff in the Office of Recovery, who are either stakeholders with lived experience and or living experience. And I think that that's important for all of you to know, is that in the Office of Recovery, each one of us comes with our own story of challenges either in mental health and or substance abuse. Next slide, please. So the recovery support services and services are essential. SAMHSA is advancing recovery support systems by promoting involvement with people in recovery and their families. It can be provided in a variety of settings, including what we want you to know is that services are not only in a clinical setting, but they are also in your own home, in a clinic, in a hospital, on crisis teams, or at McDonald's if that's where the person is most comfortable meeting. It also means that we help people enter and navigate systems of care, remove the barriers to recovery, stay engaged in a recovery process, and live full lives in communities of their choice. So also means providing a full range of support services through the systems that we engage with, and also include peers providing shared understanding, respect, and mutual empowerment. Next slide, please. So the Office of Recovery convened a technical expert panel, and our goal was to create and publish a set of national standards for peer certification that is grounded in best practice across the United States. But it was also to gather experts from the field with emphasis on lived experience, including families and caregivers who were a part of that expert panel. And I think that it's important that you know and realize that these were actions that that were meant to provide recommendations as SAMHSA develops these model standards for peer certification. But SAMHSA has no oversight or implementation authority. So we are providing these model standards for anyone who is interested across the country, whether it's state governments, county governments, potential employers, but that SAMHSA does not have the authority for oversight or implementation. And that's important for all of you to know. Thank you. Next slide. So this is SAMHSA's National Recovery Agenda and the purpose for the Office of Recovery, which is to forge partnerships to support all people, families, and communities impacted by mental health and or substance abuse conditions to pursue recovery, to be resilient, and to achieve wellness. Next slide, please. So here are the operating principles and the values that our office uses in conducting our day-to-day activities. Remembering that hope, which we believe recovery emerges from hope, and that it is the catalyst for the recovery process. Person-driven, that self-determination and self-direction are the foundations for recovery. And I'm sure many of you have heard over time the phrase, nothing about us without us. And that really truly is what we see as person-driven. And that there are many pathways to recovery. All of our journeys are very individualized. We start at different places. Our journeys are very different, and we will end up in our recovery looking very different from others or very similar to others. It needs to be holistic. Holistic. Recovery encompasses an individual's whole life, including their mind, body, spirit, and community. And then peer support, which we believe is a sharing of experience, knowledge and skills play an invaluable role in that process. Relational, an important factor is the presence and involvement of people who believe in an individual's ability to recover. Every one of us needs someone in our corner that believes that we can succeed. Culture and cultural background, including values, traditions, and beliefs in a person's journey to recovery. Each one of us comes to this journey with a part of our family, our community, and our own experience in what culture means to us. Addresses trauma. Supports should be trauma-informed to foster safety and trust. And that has been a huge endeavor on the part of SAMHSA over the last few years and moving forward. And that is making sure that all of SAMHSA's activities are grounded in trauma-informed activities. Strengths and responsibilities. Individuals, families, and communities have strengths and resources that serve as a foundation for recovery. And that's really, really important that we look at what are people, individuals, and their families' strengths. That for too long, the system has been focused on deficits, and we now want people to start from a point of strength, not deficit. And respect. Community systems and social acceptance and appreciation, including rights and eliminating discrimination, are crucial in achieving recovery. Next slide, please. So SAMHSA has national recovery agenda, and our goals are inclusion, equity, peer services, social determinants, and wellness. Next slide, please. So our first goal, which is inclusion, is to foster the meaningful involvement of a wide array of people with lived experience to improve behavioral health practices and policies, and to foster the social inclusion of people with behavioral health conditions. Again, nothing about us without us. That it is our responsibility to make sure that as many people from as many backgrounds and as many experiences as possible have a seat at the table when we are taking on any issue and the development of a policy and or guidance around service delivery. Next slide, please. So goal 2 is equity, which is to increase opportunities for recovery for underserved and under-resourced populations and communities, including people of color, youth, older adults, LGBTQI, rural, our veterans and their families, and people with disabilities. So one of the things that I wanted to talk about just for a second is that we want to make sure that everyone is getting what they need, where they need it, when they need it, and that people are fully aware that one size does not fit all. Each person is getting what they need. Next slide, please. Peer services. For each one of us, I think it's important that peer services come from someone with a lived experience very similar to our own. And I will use my own personal experience as an example. In 2012, I had breast cancer. And even though my physician, who was male, was very important to me, he was a very important part of my team, and the information that he shared with me was important to me, and I listened carefully to what he shared with me. But at the end of the day, when I left his office, I wanted to talk to another woman who was of my similar age and was going through the same kind of cancer diagnosis that I had, and could give me an idea of what to expect, what they experienced, and how they felt in the process, and if they could do it over. Were there things that they would have asked for that they didn't even know they needed? So yes, that physician was important, but another woman, having been through what I was going through, was equally important as any information I was getting from him. So peer services for us are meant, when we say that, we mean a peer is someone who is living a similar experience, who is going to be providing a service to an individual with a similar experience. Next slide, please. Social determinants of health. One of the things that we know is important is the social determinants that support recovery, including access to housing, education, social supports, and employment. And under housing, what we really are talking about is, does everyone have a safe place to live? Under education, we want to make sure that that education opportunity is accessible, that there's appropriate support, and that there are services that are available that are going to meet that person's unique needs. The social support that we are describing is there a friend? And in the community, are there people who support this person in their recovery journey? We, at SAMHSA, a couple of years ago, we had a campaign called What a Difference a Friend Makes. And for each and every one of us to have a friend that we know is not going to judge us, is not going to be telling us what we should be doing, is there to listen, to support, to provide feedback, and when asked for, some guidance. And the last one is employment. And what we are looking at when we are looking at employment is a job with dignity for everyone. Next slide, please. And the goal number 5 is wellness, which is to expand the holistic self-care strategies to improve health and behavioral health outcomes. This will include the reduction of early mortality and to impact of comorbid chronic health conditions, to integrate recovery-oriented practices and systemic reform into the full continuum of health and behavioral health care, including prevention, harm reduction, treatment, crisis care, and recovery support. And one of the reasons that this is so important to all of us is that there are ongoing studies that show that people with behavioral health issues die 30 to 35 years earlier than those without behavioral health issues. And we want to mitigate each and every one of those pieces that I spoke about with healthcare, prevention, harm reduction, treatment, crisis care, and recovery support, so that people with behavioral health issues have an opportunity to live longer and healthier lives and happier lives. At this point, the next slide is the last slide that I have. In the Office of Recovery, our core principles are that our work should be data and evidence driven. We want to increase the collection, analysis, and reporting of data on recovery and expand the identification and use of evidence and practice-based policies and approaches. As this is an evolving field, sometimes there isn't enough evidence-based research. And in those cases, we want to make sure that the practice-based evidence is used in this emerging field to also be just as important a part of the conversation. We want our work to be trauma-informed and to embed trauma-informed practices and approaches in every recovery effort, and the right to protection, to protect the human and civil rights of people with lived experiences and living experiences. Next slide, please. I want to thank you very much for your time. I look forward to whatever questions we may have, and I want to turn this back to Stacy. Thank you, Stacy.
Thank you so much, Liz. Even though I work at SAMHSA, hearing these presentations, I always learn something new. I really, the phrase that really stuck with me was nothing about us without us. And I love how SAMHSA has put together this Office of Recovery intentionally, including individuals like yourself who bring their whole person and their lived experience to the work that they do. So thank you again, Liz, and we look forward to hearing more from you when we get to the Q&A section. Next, we will transition over to Major General Mark Graham, Executive Director of Vets for Warriors, which is housed at Rutgers University Behavioral Health. And Major Graham, the floor is yours.
Well, good afternoon, everyone, and thank you, Stacy. Thank you also, Dwayne, for doing this, and thanks for SAMHSA and the Technical Assistance Center for making this possible. Good afternoon, everyone. I want to talk to you just for a few minutes about Vets for Warriors. After I retired from the Army, I think you heard my bio. During my time as a senior officer in the Army, I lost 2 sons. We lost our son, Kevin, who was a senior Army ROTC cadet, studying to be an Army doctor, was struggling with depression, and died by suicide. 7.5 months later, our oldest son was a lieutenant out of Fort Riley, out of the Big Red 1, 1st Infantry Division, was leading a foot patrol in Iraq, and was killed by an ID detonated remotely by cell phone. It continued. I stayed in the Army, continued to serve in the Army, also with a new meaning and purpose in life. And I can tell you there is hope and there is help out there. for so many struggling in whatever way you are. I wish there had been a line like Vets for Warriors for my son, Kevin, or many of those my son, Jeff, was serving with, so that they would have had a place to call and get support. Slide. So Vets for Warriors started in 1999, 2011, about 11 years ago, starting 11 years now. And you'll notice our tagline is discover the power of connection. It's all about connection. And I didn't come up with that tagline, the peers did. I had a different one, and they came to me and said, we want to change it, and we did. And they were right. To date, we've had over 89,000 hours of continuously answering phones live and counting. We never stop. Vets for Warriors is staffed by veterans. So when the phone rings, a veteran answers that phone live within 30 seconds. It's truly a team of highly trained veteran peers and licensed clinicians. So I'll talk to you a little bit more about the licensed clinicians and the teamwork the peers and the clinicians have. But our staff are paid. So all of our peers are paid employees. They're not volunteers. So it's a win-win. We pay, we hire, train, and bring on these great veterans to help support other veterans. So it's veterans helping veterans. So it truly is a win-win. Our veterans use their military background. We have Army, Navy, Air Force, and Marine Corps veterans. We have men and women veterans. We have veterans from every era of conflict, from Vietnam all the way forward through Iraq and Afghanistan, and some of our named operations and current operations ongoing throughout the world. We work together to solve problems, solve challenges and issues. Vets for Warriors is key because it's not just a call us to get a resource. You call us, we get connected, and then we follow up. We stay connected with you as long as you'd like to do so. You don't become a member of Vets for Warriors. Our goal is for you to call. Everyone's going through something at some point in their life. So whatever you're going through, give us a ring. Let's call. Let's talk early on. Let's work through it. If we need to connect you to resources and that's what you want, we'll do so. We try to connect you to community-based resources. If not, we look at state or federal resources, but we try to get you connected to whatever resource is the best, the right one for you. And then we follow up. We check with you. If you want us to, we ask you, what's a good time to get back to you, and you give us a day and time of the week. Tuesdays at 9 p.m. Okay. So a peer will contact you. Once that peer connects with you, that peer stays with you for as long as you want. And I think the following up piece is very key. So a few things about us, I think, that make us very unique. One is all of our calls are confidential and they can be anonymous. I mean, when you call and tell us your name, that's up to you to tell us your name, whether it's your name or not. We don't know that. Doesn't matter the manner of discharge or, as well. You call, if you need help, you served, we'll do all we can to assist you. We've also been asked about the word veteran. If you've ever served in our nation's military in uniform, you can call us. You're a veteran to us, and you can call us. Also, family members can call. So not only service members, active duty, veterans, if you're in the Guard and Reserve, you can absolutely call, and so can family members of all these groups or caregivers. Call us and let us know what's going on. Sometimes you just need to call and talk to another veteran. Sometimes you need more than that. Sometimes there's multiple things going on. But we want to work through those things one at a time with you to help connect you to resources and get you on the right path, to get you going again. You served your country and you deserve it. We use a model called reciprocal peer support. And you'll see there at the bottom, our model includes wellness now. About 1.5 years, 2 years ago, we added the SAMHSA 8 dimensions of wellness to our model. So it's reciprocal peer support wellness now. And our goal at Vets for Warriors is upstream. We are not a crisis line. The Veteran Crisis Line has a lot of support. They have a huge funding and many well-trained staff. Our goal is upstream. We market and try to get individuals to call us before they reach the point of crisis. Let's talk early on before you get to that point. We do have some crisis calls, and we have protocols for that as well. We also have a non-financial agreement with the Veteran Crisis Line to where we warm transfer some crisis calls to them, and then they also warm transfer some callers who are not suicidal, but they just want to talk to another veteran, and they'll transfer callers to us too. So we've been working with them for years and have a good relationship there. But we are who we serve. So we'll match you up with the right person that you want to be matched up with, or If you don't want to be matched up with that person, we will get you someone else, but we want you to be matched up with the right peer. We've never really had anybody ask to change peers, by the way, but I do always mention that. And we're here to hear. We're here to help, not judge. I often tell everyone it's a stigma-free zone. I feel with my son, Kevin, I was part of the stigma too and didn't even realize it at times. So we want to make sure we're very careful that when somebody calls, no matter what you call about it, it's important to us that we treat you respectfully and responsibly, and we make sure we do all we can to support you. We've had over 760,000 contacts. So if you or someone out there you serve or someone you know, if they wonder, gosh, I don't want to be the only one that calls them, you're not. We've had a lot of people contact us over the years. We currently do over 2,000 peer support engagements. So right now we're helping about 2,000 veterans, service members, family members right now. And then that changes. It's kind of like going down an escalator. That number moves all the time. Because people will say, hey, Mark, I appreciate all the help. I'm good. I don't need to call back at this point. And we always tell them, we're here 24/7. You can always call back anytime. And some do. And that's why we're here. That's great. We typically average over 7,500 contacts a month. Slide. And just so you know, we don't do this alone. We don't think we're the end all be all. We know there's a whole network out there of support. And we're part of that team. We're very collaborative. We are very appreciative of the partners that support the work we do. You can see some of those on the screen. I didn't put everyone up there. There's not enough room, but I think many of those will look very familiar to many of you. So we're very collaborative, and we want to work together. We want to make sure we're getting those that reach out to us connected to the best resources possible to get them help and support in whatever they might need. And I'll talk a little bit about that, but whether it's employment, education, whether it's short-term finances, mental health care, whatever you're going through, we can connect you to a resource. Slide. A little bit more that on the top right-hand side, you'll see a collage there of pictures. Those are we have a board in the call center, and those are individuals who get to put their picture up on there. I would tell you there's a prize if you can pick me out of a picture, but there's no prize. So you can still try to pick if you like. Again, we have our peers 24/7. They go through we go through a certification. We're formalizing the certification this year. So by the end of this year, there'll be a Rutgers Health certificate in peer support issued. That's being done by the Rutgers University Behavioral Healthcare's Behavioral Research Training Institute. That's operating that. Right now, there are 3 courses for college credit that are taught at Rutgers that were based on our work that individuals can also apply for and get college credit for. We do warm handoff to resources. We try to do warm handoffs as much as we can, just because it's more personal and we want to make sure we stay connected with the veteran as well. And I'll talk a little bit about the reciprocal peer support model. I won't get into that too deep, but I do want to let you know there's 4 tasks in the model. Those tasks are embedded in our software. So when you contact us, the peers they're going through the model, but once they've been around for a while, they know that model well, and they go through there, and they'll ask some questions. They want to get to know you. They want to know some strengths, some challenges. What are you going through? So we can work together as a team to get through whatever you're going through. And just so you know, in 2011, the Defense Center of Excellence named our peer support model a best practice in peer support nationally. And in 2018, the American Psychiatric Association awarded the Silver Award for Service Achievement for our reciprocal peer support model. And also in 2018, the University of North Carolina at Chapel Hill, the Global Peers for Progress came in and did an IRB study on our model to validate it. We knew intuitively our model worked, but we knew we needed somebody from the outside to come in and validate that. So we could say, hey, they did prove that it is evidence-based based on their work that they did. And that was done in 2018. The only thing they told us that we really needed to work on was we needed to add a wellness component. And as you can see, we have added the wellness component a few years ago to some of our smaller peer programs in our call center. And then at Vets for Warriors, which is our national program, we started that about a year and a half to 2 years ago. Slide. Yeah, just a few things are important. As I mentioned earlier, it takes a village, as we all say, but one size does not fit all. So there's not one program out there that fits everyone. So it really is a collaborative effort between all the different organizations. around the country. Our peer support model is culturally based. So it emphasizes strength and combats stigma. It enhances treatment. Oftentimes we get callers who are in treatment, but they start talking about it, and we'll help them realize that they've got to open up completely to the clinician to get the best care they possibly can. And we help fill those gaps and needs to help them understand more about treatment. 75% of our peers are combat veterans. So many of them have been through combat. As we all know, the military, just in general, is a dangerous occupation and stressful. But it's important to know that the clinician-peer partnership is another piece that separates us. And there are several things I've mentioned already that'll show you why we're separate. We're 24/7 nationally live within 30 seconds answering the phone by a veteran. We also have clinicians. The clinicians don't answer the phones, but the clinicians do most of the training. When someone is hired at Vets for Warriors, they go through a 40-hour didactic training to learn a lot of things. Trauma, they do some trauma-informed care training. They do some motivational interviewing. They do active listening. They get reciprocal peer support training in the model by Cherie Castellano, who developed the model, who still works at our call center. And then the clinicians also go through cases. They talk to peers, and they work with the peers. Like, you've been talking to Mark for about 3 or 4, weeks now or so. How's he doing? Anything else we can offer him that we haven't yet? And they talk through this with him from a clinical way to a peer, which is very helpful. And the peer continuum of care is something that's important. We help all the way through the continuum from the time somebody calls. If we need to do an outreach, we do community outreaches in some cases. And we also do resilience and wellness events. The other thing that's important to us is making sure we're taking care of our peers because they do get some tough calls, as you can imagine. So we want to make sure our peers' wellness is good as well. So we have resources for our own peers to make sure that their well-being is taken care of. Again, it's confidential and very accessible. Right now, you can get to us by phone. We have a chat function on our website. You can email us. And coming soon, hopefully this month, if not by the first part of April, there'll be a mobile app that'll be up on our website that you can download for Vets for Warriors that allow you to do several things. And we'll continue to add functionality to that app as well. And we're also bringing on a new texting platform. We had one before. I didn't like it. It didn't work as well as I wanted. So we're going with a new texting platform that we'll be rolling out here soon as well, just to make sure we're meeting you where you are. Over 85% of those that contact us do so on a mobile device. So we want to make sure we're accessible to you. We don't want anyone to be alone. One of our goals at Vets for Warriors is that no one is ever alone out there, that they know they always can reach out to Vets for Warriors 24 hours a day, and a veteran's going to answer the phone. A veteran's going to get out on that chat on the website and soon through the mobile app, which will be like a texting piece they can do. We are also task and data driven. We measure ourselves and watch ourselves and make sure that we're meeting the very high standards that we set to make sure we're giving you the best possible support out there. And I would again mention that we do employ our peers. So we hire veterans to help other veterans and their families. Slide. Just to give you a little data, just because I think some enjoy data. We currently support over 2,000 individuals right now a week, doing over 1,800 contacts. You can see we're national, international. We get calls and chats from other countries. When we were in Iraq and Afghanistan, we got several would reach out from Iraq and Afghanistan that were struggling. We were working them. We've gotten 4 calls from Navy ships. So we get a lot of different calls from a lot of different places, and people reach out to us. Again, we're upstream. It's very important, I think, to be upstream. Let's get in front of this and not wait until someone's at the point of crisis to help them early on, to know there is help. There is help. There is hope. Please don't be out there alone. Connect with us. Our peers are trained to do that. If we don't know the answer, we'll tell you we don't know an answer, but we'll get back to you, and we'll do that. We'll continue to stay with you until we get the right answer. And we've had peers making phone calls on behalf of someone else 4 and 5 places until they can get them in somewhere for care. And sometimes it's just a phone call. 2 o'clock in the morning, we had a Vietnam era veteran from the southeastern United States called. He talked to one of our peers. I think she was probably 24, 25 years old, combat veteran. They talked for 20 minutes. And at the end of the call, she said, I'd like to give you a call back and check in, see how you're doing. He goes, This is just what I needed. Somebody gave me this number and said if I called it, a veteran would answer live. And he goes, at 2 o'clock in the morning, you picked up the phone. And he goes, and I just appreciate it. That's what I needed tonight. That's peer support. So whether it's one phone call or 6 months of us calling you every week or two, and the clinicians help us determine how often we should call you, it's peer support. It's all about working together. And you can see in 2017, we were averaging about 10 new individuals a day reaching out. New individuals means someone has never contacted us before, because in our system, we can see if that phone number's been used before or called in before. And in 2022, we're averaging 21 new individuals a day. So you can see the growth. I laugh and say I don't do math in public, so I won't hear, but 21 new individuals a day is a lot of individuals reaching out to us. And that is on top of those that we're already helping. Slide. You can see I threw in a couple of graphs here because I want you to see, a lot of times you won't see a graph unless it's all good news. And I want to show you this is good news, but you got to see the context behind it. As you'll see in these bars, and it's probably hard to see for some of you, you'll see how the blue bar is the total number of incoming and outgoing contacts, whether that's an email or a phone call or incoming and outgoing, right? You can see how it going pretty well, 18, 19, FY20. Look at 2021, 22, all that's during COVID. So you see the COVID impact hit because we're a fiscal year. We do July through June. Pre-COVID, you see the line, that's kind of where we were. And then post-COVID, and our projection for this year is we're going to be above 2022. So we've kind of come out of the big COVID piece. And the reason in 21 it jumped up is a lot of organizations that support you and others weren't able to do the work they do. They did retreats, they had meetings, they did other things. They weren't able to do that in person. So many of them reached out to us and said, is it okay if we have people that we were going to have at our retreats or meetings and do things in person, if we give them your number? So if they want to reach out, they can contact you. And we said, absolutely. So you can see that worked. So we worked together. And then in 2020 and FY22, those organizations started to open up again, which is a good thing. And, it went down a bit, but now we're going back up again just because the word's getting out more and we're connecting with other organizations. And you can see that on the right-hand side of that bar, that's only 3.5 months to go for the year. So that's our projection as well, that we'll be there. Slide. This is the top reasons for calls. I mean, I don't think this will be any surprise to any of you on the webinar today, but these are the top reasons for calls. We change this quarterly as it rotates. Again, I don't think there's any surprise. I'm not sure there's a reason now at this point after over 10 years. There's probably not a reason we haven't had for a call, at least one. Also, I wanted to show you a little bit about the service area of the contacts. Just 54.6% post 9/11. That sometimes bumps up to 62% and moves around a little bit, but this is last quarter's data. Pre 9/11, 36.6, and then Vietnam 8.6. So you can see we still have some Vietnam era veterans out there that are reaching out to us. We have Vietnam era peers that answer the phone. They don't work full time; they work part time, and they're great and make a big difference. Also, I thought it was interesting to show you that from calendar year 19 to 21, contacts went up 5.7%, just contacts. But look at the new contacts in that same time period from 19 to 21. So a lot of individuals were reaching out to us, struggling. It was a tough time. Loneliness, isolation used to be the number one reason people called for years. And that started getting lower on the list, and then it started bumping back up again with COVID, as you might expect, right? Slide. And just another slide to show you some new cases. I think the key thing here again is to see the COVID impact, and it's important to show you that we worked with others very well. I thought during that period of time, we were able to stay open, and we went remote very quickly. Even my boss was shocked to see how fast we were able to transition a 24-hour operation to being fully remote. We did it literally within 24 hours. We rotated by shifts, so by the next day, the morning shift was on track remotely, and everything was going fine. We didn't miss any calls throughout the process. So a great teamwork, and you can imagine with a bunch of veterans, they've learned to do a lot of that kind of work in the military. So it was impressive to see, and it was fun to watch other organizations see how our team did this. So you can see a lot of new individuals contact us, which is great to see. And we'd love you to spread the word and help. Please make sure others know Vets for Warriors is out there for you and for others. Slide. Just thought I'd let you see where people are calling from. Now they call from all over the country. We've had calls from all 50 states, the territories, and I think it's 18 other countries at this point we've had calls from. But we track states, and I wanted to show you on this webinar, since we started, the states in the orange color, the dark orange, those are the top 10 states. And on the left-hand side, you can see. Now, some isn't a surprise because of the size of the state, Texas, California, and Florida, no shocker there. But you can see the other states for multiple reasons. Colorado and Illinois, in the last quarter, they popped into the top 10. And we also do some focused marketing. We did some of that in Alaska about 6 or 8 months ago. And we had a big response from Alaska. We're getting ready to do that again. With the challenges they're having up there with suicide. So we want to keep doing that. So we wanted to show you, you can see a lot of population is on the East Coast and in some of the bigger states. But anyway, just point of interest, because people typically ask me, where are people calling from? Well, they call from everywhere, but these are the states they call from the most. Slide. Yeah, just as I get ready to close here, I'll go over a couple things on this slide. Just to reemphasize, we do answer the phone live. It's confidential and it's 24/7. And a veteran answers the call. They're employees and they're trained. They go through the training process. And this year we'll have a certification form, a formal certification. There's other certifications out there, but we wanted one that was run by Rutgers Health through them. And Rutgers Health has all the medical schools, the dental schools, the nursing school, the school of health professions, and all that combined. So having a certificate, peer support certificate from Rutgers Health will be very important, we think. Again, the peer clinician partnership is essential. So we have peers, we have clinicians, and then we have supervision. So it's a structured system, right? It's a structured system that we have. So we have checks and balances to make sure we're doing all we can to do the right thing for those reaching out and calling us. And peer support really is a continuum of care. We follow up. If you want us to reach back out to you, we don't just continue to call you if you don't want it and bug you. But if you want us to, we will. And about 50% of those that call us, they want us to call them back. I was really surprised at that. I didn't think it'd be that high a number for veterans. I thought it'd be lower. It's actually more like 60-something%, but I'm pretty conservative. And I said, show 50 on the slide. So they did. But that's important to me. I think that many individuals want us to reach back. Even if we connect you to resources, many want us to call them back anyway, because then they want to say, hey, I went to that resource, here's what happened, because we want to track that. If we connect you to a resource and it didn't go well, we want to know that so that we don't send other veterans or family members or service members to a resource that we didn't get good feedback on. So we have like a thumbs up, thumbs down little thing in our automated system where peers can click on that so we can track what's going on there. We have a program for volunteers. Some people ask us, how can we help? Donations is always something we tell people, but we get funded through grants and other ways. But we have a program called the Ambassador Program. Here's the link here. I think Dwayne's going to put it up in the chat for you. But here's the Ambassador Program is anyone who wants to volunteer to help us get the word out. And we have a lot of people that have done that already. It's continuing to grow. Actually, it grew faster than we were ready for. So we're playing catch up. We've now got somebody we brought on full time that's starting to coordinate that program. For those of you out there that might be an ambassador already, we thank you for that. We're going to continue to engage with you more and more. We just, in 2 weeks ago, we opened an ambassador portal on our website. So for those ambassadors that want to have access to that, they can submit to get access to that, and we'll give you access to that. Inside that portal is a digital toolkit that was provided by Wounded Warrior Project. They gave us the funding for this digital toolkit, and we told them, we thanked them for the funding to do that, and we took the digital toolkit and we embedded it into a portal on our website. It works really well. It's got downloadable things you can use so that you can go out to your social media network and you can tell others and share about Vets for Warriors so that we can make sure there's no one out there alone, sitting by themselves, no telling where, just thinking that there's no hope, there's nothing that they can do. But there is something. They can call and talk to another veteran 24 hours a day live and get help. We're all over social media. Please follow us and join us on social media. Our handle's at Vets for Warriors. So we'd love for you to join us and connect with us and make sure others know about us too. So whether it's for you or someone else, we're here 24 hours a day. Slide. I thank you for your time, and I thank you all for those of you that have served or family members of those that have served. For Gold Star families, Liz, I know is a Gold Star mom, and for those Gold Star families, my thoughts and prayers are with you and your families. We thank you all for your service and for what you do for our nation each and every day. We're here for you, and we again, Dwayne and Stacy, thank you so much for the opportunity to share Vets for Warriors with your great audience and for all the work you all do at SAMHSA and also at the SMVF Technical Assistance Center. And with that, I will pass it back to Stacy.
Thank you so much, Major Graham. We really appreciate your dedication to the population that you serve, as well as all the great information that you've shared about how peer support works at Vets for Warriors. We're going to go ahead and transition over to a few minutes of questions and answers. So we have had a lot of activity in the chat, some great questions about peer support in general, as well as some specifics about how things work at Vets for Warriors. Liz, my first couple of questions, I'm actually going to kick over to you. There were a lot of questions regarding peer support certification, and I know that you mentioned during your presentation that this happens at the state level and that SAMHSA has issued some core competencies. So wondering if you could speak to that a little bit more about certification at the state level and those resources that SAMHSA has available.
Sure. What we are in the process of doing is developing those model certifications, because across the country and in all of the territories in the District of Columbia, every state has the authority to set that criteria, and they have their own licensure boards. And so we are hoping to come up with the best of the best with a model and hoping to encourage states to adopt those. But in all of that hope, there are going to be states who are going to choose to go their own route. And so we are in the process of developing them. We are hoping that by the end of June, they will be available on the website for people to take a look at. That will be the resource that we will be making available. And that from that point, those individuals who are interested in advocating within their own state for those that model of certification, that information will be available to them. But when you have this kind of system, which states lead the way in what certification looks like. And so we're working to get them the best information that we can.
That is really helpful, Liz. I know that things kind of expand quickly in terms of SAMHSA's resources. I know that in 2015, SAMHSA issued those core competencies for peer workers in behavioral health services, which we'll make sure to drop in the chat. But it's really exciting that SAMHSA has built off of that and is now going to issue standards for certification at the state level. Really exciting. State and territories, I might imagine that some territories might be using peer certification as well. There was another question that came up in the chat a couple of times. You mentioned information on data as it relates to mortality in the population of individuals who are experiencing mental health disorders, and wondering if you could repeat some of that data because some individuals indicated that they missed it, and also wondering if there's a source for that. I'm wondering if that information came from CDC or another source.
This afternoon in our staff meeting, I will get the source and I will send it to you and Dwayne so that you can post it for those individuals who are interested. But the studies to this point have shown that people with behavioral health issues, it is not unusual for them to die 30 to 35 years earlier than individuals who do not have a behavioral health issue. And a lot of that comes from the side effects of the medications that people are given. A lot of it comes from the fact that there is an increase in individuals who use tobacco products. And so there are a lot of reasons for that early death. But overall, we see that the more involved and the deeper someone is in the behavioral health system, they are more likely not to live as long as the typical population. But I will get that information for you, Stacy and Dwayne, as soon as I can.
Thank you so much. We'll be happy to share that forward to attendees after the webinar. Major Graham, there were a number of questions regarding Vets for Warriors and the dynamic work that you all are doing there. There was one question that I wanted to pose to you about, you mentioned some international callers. Folks specifically had questions about military allies, such as Canada, British forces. Are there services that are being provided to international military through Vets for Warriors?
No, that's a good question. My area, it's U.S. military that are serving overseas, or our veterans are living overseas. They're U.S. We have had calls from British soldiers and from Canadian soldiers that have reached out to us and talked to us, and we have done our best to help them. But we just don't have the access to a lot of near the resources for them that we would for others. But no, this is for U.S. military veterans and their families.
Thank you. That actually touched on my next question. Can civilians contact Vets for Warriors? And you did mention families. And is there a different, I guess, track per se for family members who contact the line versus active duty service members or veterans?
No, we family members, they might need different resources, and family members can call because they're concerned about a loved one that's in the military or a veteran, or they can call for themselves if they're struggling. I mean, oftentimes families are going through a lot of the stressors and everything else that, based on the military and military life. And so family members can call for themselves. And I had to tell you, I mean, we've had some people that are civilians that have contacted us who are struggling and we're connected to the military. And we explained to them what the line is about. We certainly tried to help them. We didn't turn them away. But yeah, family members are, we treat them just like we do when a veteran calls too. We do our best we can to support them and connect them to the best resources possible, and reach back, and we'll do follow-on calls with them as well if they want.
Thank you. Another question, had a number of questions regarding training for the peers who work there at Vets for Warriors. And I know that you touched on this a bit. So folks had questions about what the training looks like in general. And you also specifically mentioned the reciprocal peer support model. So there were some questions about the origin of that model as well.
Great.
If you could speak to that.
Oh, absolutely. So reciprocal peer support started in our call center. Sheree Castellano is she's a licensed clinician. She developed it. Her husband's a police officer, and she saw a lot of mental health and sadly some suicides in the police force. And so she thought there needed to be something done about it. So she applied for a small grant, a state grant, and got approved. And she from that, she developed the reciprocal peer support model, and she's continued to improve that model over the years. We have 12 peer support programs in our call center. All of them, but Vets for Warriors, are state-based programs. Vets for Warriors is the national program, and all of our programs use the reciprocal peer support model. So yeah, it was developed there, and that's when they get a certificate. All new peers coming on will be required to be certified within a certain period of time, and then the current peers will take a competency exam, and they pass it, they get a certificate, and if they don't pass it, then they go back through the training. But yeah, that'll be on the reciprocal peer support for wellness model, which is a different model because it is a strength-based model and it's based on cultural peer support. And the other question was, training.
Yes.
So the training is staff get initial training. It's about 40 hours of training. And then we have experts. So in the call center, I run the entire call center, and I also run Vets for Warriors. And in our call center, we also run the state suicide crisis line. We also, in our call center, we have a team, and they're one of the 988 national backup centers. So we do that work as well. We also run the state substance abuse lines called Reach NJ. So we run that state line as well. So we have a lot of different experts in the call center, a lot of substance abuse experts and crisis experts. So those individuals are the ones who do the training. And then our clinicians at Vets for Warriors do the training. Plus we have other people who do, customer, training on, just, customer relations and those kind of things, making sure we're doing those things right. And then once you go through the training, you don't just jump on a phone and start answering calls. Once you go through the training, you spend time and work with a seasoned peer that's been around for a while, an experienced peer. And then that way you can ask that peer questions. And then for a period of time, you'll answer some calls, and then there'll be another peer that's with you. That's so you can kind of make sure see how you're doing. And after the call, they'll go over the call with you and say, okay, you could have asked this question, you could have used this resource, just to help them. And then at some point, the supervisor will say, okay, you're ready to go on your own. So you take calls on your own now. So that's kind of where we want to get to. So in the military, it's kind of like a left seat, ride, or a shadow program. We do that. And then we have periodic trainings all the time. The peers will bring up, I'm getting calls about this certain topic. So then the clinicians will put together a training for that topic, and then we post that on our site, so it's always available to our peers. So we're always training. Right now, we've got some staff going through assist training that was funded by an organization. We got some other peers that are going through some means reduction training that was made available to us. And then being where we are at Rutgers University Behavioral Health Care, there's a lot of training available to us in person and online as well. So we have a lot of training options for our team.
Thank you, Major Graham. I really appreciate the concept of, training via left seat, right seat, when you can see the job happening in action. That's really important. And for those who are on the webinar, Mr. France put in the chat the information on reciprocal peer support model. There's an article there that you can reference to learn a bit more about that. So thanks for mentioning that as well, Major Graham. I also liked how you mentioned that your training happens kind of on demand. When peers are noticing emerging issues and bring that to the clinicians and the supervisors, that specific support and training is developed for them on those topics. Also, I'm sorry, I'm saying Major Graham instead of Major General Graham, but General Graham. I also noticed that you indicated that your training has longevity because it's posted on a website that they can refer to on a regular basis as well. Right. So appreciate all those pieces that come together.
And Stacy, excuse me, if I could, I can give you an example of a topic that would come up, and the peers would say, hey, we're starting to get calls on food insecurity. This happened during COVID, and we never really had gotten calls about food insecurity before. But we started getting calls about food insecurity. So the clinicians put something together for that. And then we also had we put together, we call them like a tiger team. We put together a small team and said, okay, go out and start looking for resources that help with food insecurities, food pantries and all that. So we would connect to organizations and who had access to food pantries and all that at different parts of the country. So that's kind of how we do when the topic comes up, when the peers identify some certain type calls coming in that we want to focus on.
Thank you for that. That on-demand nature of addressing those practical needs, I'm sure is really helpful to your peers. So thank you. I did want to switch back to Ms. Sweet, because there were a number of questions regarding funding for recovery supports in the community. And wondering if you wanted to provide some specific information about funding that might be available and how funding streams work. And Major Graham, feel free to jump in as well if there if there are thoughts that you had about funding streams that your organization has used.
Sure. Here at SAMHSA, we are funded through Congress. And so as that money is appropriated, programs are developed within SAMHSA's purview, within the Center for Mental Health Services or the Substance Abuse Center or the Center for Treatment. And I would invite all of you to go to SAMHSA's website and look on the bar that's available under grant opportunities. And you can put in a search title for peer support. You can use a title that might fit better with what you're looking for in that search bar, and it will tell you what kinds of funding opportunities, what grants are available from SAMHSA for this activity. We are also doing partnering activities with the, Stacy, you may have to help me out because right now, HRSA is an acronym, and it is a sister agency.
Yeah, Health Resources Services Administration.
Thank you. And it's a sister agency who is also working on workforce development, and peer support is one of those avenues that they're working on. So I would not suggest to folks that they limit their search to just SAMHSA, but there are partnering agencies in other places within federal government where peer support is also being looked at as not only a service in a grant program, but also in a way to alleviate some of the stresses on the workforce currently. I hope that helps in answering the question that the individual had.
Thank you. And I see that Mr. France has put in the chat the links to the grant funding pieces of the website for both SAMHSA and HRSA. So thank you for doing that. General Graham, wanted to give you an opportunity if you had anything to share about funding over at Vets for Warriors and how that has worked.
Oh, glad to. So Vets for Warriors started out in 2011. Got some funding from the National Guard. I was not there yet. And then it got some DOD funding for a while, and DOD decided to go a different direction and has since stopped it. But when that funding ended, the state of New Jersey decided to provide baseline funding for the program. They determined that it was too important to let this go, so they kept it going with baseline funding. And then the arrangement we made with the state was, if you continue baseline funding, we won't come back to you every year asking for more money. We'll seek grant funding and donations to keep going. So a public-private partnership, which is what we are. If you look, so Vets for Warriors is a 501c3, but we're not a separate 501c3. So if you look us up under Charity Navigator or GuideStar, you won't find us because we get our EIN number through the Rutgers University Foundation. And that's how we're set up as a 501c3. But our funding comes some from the state, and then more than 50% of it at this point is from grants and through donations.
Thank you for that. It's that partnership at the state level is really important. We did have a couple of questions regarding language-based services. Wondering if Vets for Warriors is specifically in English, or do you have peers who are available to provide services in other languages at this time?
We do have peers that speak other languages, probably 4 or 5 different languages. Not someone on every shift, but if someone calls in and they want someone that can speak in a different language, then we'll connect them to that peer, depending on when that peer is working, but we'll connect them to that peer. And if we don't have someone that speaks that language, we use a language line system to help with that. But it's, as you know, it's definitely much better to have a staff member who can speak that language. The other good thing is if we do have someone who speaks another language and we're really struggling with that, there are individuals in the call center, clinicians or others who speak different languages that can help us at least get the conversation going with them in their language so that we can make progress there.
Thank you for that. I had another question regarding, are there any opportunities for face-to-face peer services through Vets for Warriors? Is that a model that you're using right now?
It is not. Some organizations do peer support face-to-face, others, some we do not. We do it strictly voice and chat. We have the capability to do telepeer, where we do like on a FaceTime or through a video through Zoom or something else. What we find is, interestingly enough, is it's kind of like riding on an airplane. When you sit somebody on an airplane and you talk to them and you tell them all this stuff, and when you get off the plane, you go, wow, I can't believe I told that person all that stuff, because you want to talk to someone you didn't know and you're never going to meet again. So what we find out is with most callers, they like this concept because they want to just be able to open up and share and talk to somebody. And so I think there's a need for both kind of peers in person and then peers this way, then you can do it. So I think it's a blend. That's why we always say one size does not fit all. Some people want to meet with another peer in person. Some do not. Some call us and say, hey, can you connect me to an organization where I can meet with a peer and everything else, and then we do that. We'll connect them to other organizations. But no, at this point we do not do it in person, and but we do have the capability to do it like over Zoom or other platforms.
Thank you. That's definitely innovative to use that extra kind of virtual piece that has become so popular, since 2020, to be able to connect on screen.
For sure.
Yeah. Did have some questions that I'd like to open to Ms. Sweet or to General Graham about kind of ways that we can all work to reduce stigma and support military families a bit more and military members in kind of overcoming that stigma hurdle to be willing to reach out and connect to services. Wondering if either of you had thoughts on that.
I do. And I'll let Liz jump in too. I think one of the key things for Vets for Warriors is to get beyond the stigma. We want to, there's no stigma at Vets for Warriors, and oftentimes people feel that there's stigma where they are. They can't open up and talk about what they're going through for fear of being in trouble. To include veterans in the civilian workforce, they don't want to tell their employer they're struggling. This gives them a way to reach out and talk to somebody and open up and tell somebody they're struggling, and for them to get help, because there is hope and there is help out there. There are so many great organizations and programs that can assist individuals to help them personally and also make them a better employee. So it's interesting that, we have units in the military, we have veterans that are employed, and they're connected to resources and care that's helping themselves. And by that, they're also probably a better employee, doing a better job. Their family life is better. So everyone wins. And it's a shame the stigma is still out there, but it is. And is it getting better? I think we made some progress on it. I think Liz would agree. It's never enough, fast enough. But I think we're making some progress on it. But this is a way to fill a gap. If you're in an organization or a place that supports you doing that, that's great. One of my soapbox items right now is we need to be consistent in the military, between the services and also between installations when you move from place to place. Same with employers. When you go from one employer to the next, the culture should be that you can be open and say you need help, just like you do for a physical illness or a physical ailment or injury. Do the same thing for mental health.
And I would only add that the stigma of needing help is probably the greatest barrier that I have seen with folks that I have dealt with who are coming out of the military. It's like, if this was something that I didn't feel comfortable talking about while I was in the military, I don't think that's something that I want to take to a new job and an application that I am going to be filling out. And I just want to use the example of when our son died in Iraq in 2003, there were 4 of the fellows that he served with that stayed in contact with us. And one was his battle buddy who carried a lot of survivor guilt. And so when I would say to him, here are some resources I really want you to take a look at. And for a very long time, he said, Liz, you were the only person that I feel comfortable talking to about this because I don't want everybody else to look at me as the person who didn't do their job as your son's battle buddy. And so we talked for a long time, for several years. And what I would ask of him was, send me a letter telling me about a time that you spent with TJ where he made you laugh, or when you think of his name, something that makes you grin. And he did that with me for probably 3 years. And finally he said, you know what? I now think of him and it brings a smile to my face. And I think I'm ready to take that next step. But all 3 of those fellows went through a whole lot of survivor guilt and the stigma of, I didn't do my job. The sergeant who told me, I promised you on that day of deployment, I would bring him back to you, and I didn't do it. His friend who said, the morning that TJ died, I believe I was the last one to talk to him. Our paths crossed on the sidewalk. I could tell he was upset about something. I didn't know what it was, but I had a choice. I needed to get to formation, or I could stay and talk to him. And I asked him if he wanted to talk. He said no. And so I went to formation. And now I can't get over, if I had only talked to him, if I had only talked to him, if I had made a different choice. So that stigma of guilt, not having done their job, and not one of them didn't do their job, not one of them. But having somebody who can reassure them that there is no one that is holding them responsible except themselves, and getting them the kind of help that they need from another soldier who's been there, done that, is really, really important. And I also wanted to just say, for me, when I look at what is the role of peer support, it'll be 20 years ago this November that our son lost his life in Iraq, and his death has been deemed a suicide. There are some questions that are still unanswered, but when TJ lost his life in November of 2003, I was a mom who just was looking for answers. I needed to know. And SAMHSA was just scratching the surface about getting involved with veterans issues. And I had an opportunity to go to a DOD conference in Florida on suicide prevention. The conference was in 2005, and I met the most wonderful woman there who also had a son who had died as a result of suicide. She was also someone who had a degree in guidance and counseling and was feeling the same kind of pain of, my degree is in guidance and counseling. And so like me, it was, if I didn't see these signs and symptoms in my child, do I have what it takes to be able to provide that kind of help to someone else? And we stayed in touch. Both of our sons were deployed from Fort Riley. We had that as a connector. We had our job, our degrees as connectors. Both of our sons were in Iraq. We had that as connectors. And I just want to assure people that it's oftentimes we see people who come on a webinar and they provide information, and most often it's good information. But I want you to know that General Graham and his wife, Carol, not only talk the talk, they walk the walk. That wonderful woman who I met in Florida at that conference was Carol Graham. And Carol and I have remained friends for this 20 years. We have talked to each other in conversations that we wouldn't feel comfortable having with somebody else. It's an opportunity to be a peer when the word peer support wasn't even around. And in that relationship, we are now grandmothers who share our pictures of our grandchildren, who share our birthdays. Our family has visited their sons' graves. They know where TJ is buried. There are ways in which, for General Graham, this is not just I know the information, I can be a spokesperson. This is someone who knows it, walks it, lives it, talks it. And so I just want to say, Mark, thank you for being a part of this panel. When I was invited to participate, I did not know who the other participants would be. And when I found out it was going to be Mark, it was like, there couldn't be anything better in the whole world. So thank you, Mark. I really appreciate the work that you're doing and continue to do.
Well, thank you, Liz. Very, very kind of you, and the same for you. And we are connected and always will be. And Carol sends her best to you, by the way.
Thank you.
Yeah, I think the stigma can still be around, but there are ways to get past the stigma, and that is to reach out and talk to someone.
Thank you, Stacey and Dwayne.
Yeah.
Thank you both so much. I will say that when we planned this webinar, we did not know that the two of you were connected in this way. And I think it just speaks volumes to a couple of points that you both raised. Stigma is largely about the messages that we give ourselves, the messages that we've internalized from different places in our lives. And there's such an amazing healing power in peers. Just the two of you in these last couple of minutes sharing the connections with your families and with your work, and how there's been a healing power in those relationships, and giving to one another and giving to communities. So I think that's a good place for us to close as our time together comes to an end. Here you just have a reminder of how to reach out to SAMHSA. And Dwayne, if you could go to the next slide. We'll also have information on how to reach out to SAMHSA's SMVF TA Center. Really appreciate all of the interactive communication on this webinar. We've had a number of questions that we unfortunately didn't get to today, but please reach out to us and look into our future learning events. And thank you again for joining us. Take care.